Happy hump day. Questions that you might have on liposuction, fat transfer, Brazilian butt lift, 360 lipo. We're talking about whatever, all things lipo, whatever I talk about. And if you guys have other questions, I'll do whatever I can do to help. What's up, Margaret Bowman? So we are live on Instagram, Facebook, and YouTube all at the same time. So if you guys aren't following us on those other channels, I'd suggest you do that. Thanks, Margaret. I am having a fantastic day. So today I had 4 procedures, busy day, but I work quick. Get that fat out, right? It's crazy how it's it's taken people decades to put the fat on, and within a matter of a couple hours we can remove large volumes of fat and undo all the damage that you've done. It's pretty cool. Let's see. First question here. I see Marilyn on Instagram asks, how many areas does the 360 lipo cover? So the 360 lipo is not necessarily a number of areas. Rather, it's a concept in that we're going all the way around the entire waistline. So each individual is different. People are different sizes. So the areas are a little bit different depending on how large you are, how much you need covered. It's really a surface area that we're covering. So those individuals that, like, say you're 400 pounds and your belly comes down to your knees, you're going to have more areas to treat than the individual that's 150 pounds and the belly doesn't fold over at all. So to answer your question, how many areas, the first step is you want to get a consultation with us, and then we can review your pictures, or if you're local, you want to come to the office, you can do that as well. And we need to figure out what you need treated and if 360 lipo is even right for you. But that's the first step. You want to get your consultation, and we'll determine what areas need to be treated and how many areas that is. Let's see. I think this is one of the patients today. Says that they're feeling great, drinking lots of fluids, and thanks for removing the 4 liters of fat today. That's awesome. You guys see any questions that I'm missing? Armanda Miranda, she had liposuction from another doctor here in town, and she's asking, is it normal for it to not look even? First of all, I don't like to talk bad about anyone else, so I'm not going to say whether they did a good job or a bad job. I don't know what you look like, so I don't know for sure whether it's right or wrong. Everyone's different, and the way they heal is different. Swelling is not it's not that it's abnormal. Swelling is not uniform with everybody. So what I mean by that is some people swell a lot more than other people. Some people swell irregularly, meaning that you might be more swollen in one part of the area treated than the other, which all this can throw off the visuals of the way it looks. So just because it looks uneven now doesn't necessarily mean that it's going to be uneven in the long term. If you just had the procedure done, swelling is swelling, so you just have to be patient. Keeping compression on it is the best thing to do. Let's see, Johnny on Facebook, how much do we charge? All of our fees are on our website at myshapelipo.com, and how much we charge depends on what you want treated, obviously. So we charge $12.99 per area for liposuction. We charge $2,000 for the process of fat transfer, and we charge $650 per area for a smart lipo laser. So you'll get a combination of all of those depending on how many areas you want treated. That'll determine the price. But again, the next step would be to get your consultation. The free consultation will determine what you need treated as an individual and what we would recommend. And we'll answer all your questions. If you have personal questions about your health or medical problems or anything of that nature, we can answer those on your consultation, and we'll also give you an accurate quote based off of the what you want treated. So I'll step aside so you guys can see some of these pictures here. So this is it's a really cool picture. I like this. You know, you can see how the abdomen was folding over prior to the procedure, and we call this a pannus. So as you get larger, gravity pulls down on the weight and causing this fold, or a pannus, or an apron, some people call it. And liposuction, when you remove the volume, you remove the weight that's pulling that skin down, uh, the skin bounces back. And so this is not a tummy tuck. I repeat, this is not a tummy tuck. I see people putting in tummy tuck here. This is not a tummy tuck. This is liposuction only. So once you, this is simple physics here. Once you remove the volume and the fat that's hanging, that's pulling the weight down on the skin will retract back, and it will retract quite a bit. Everybody's different, so we can't guarantee how much your skin is going to retract or what the results are going to be specifically for you. However, when you look at the pictures, you can just see what's possible. So, you know, when you're considering what's going to be right for you, you have to understand what is possible with what we do. Every time you're going to go to a plastic surgeons, they love tummy tucks. That's all they do is tummy tucks. So when you go see them, they are going to recommend a tummy tuck, and it doesn't matter whether you're, you know, 100 pounds or 500 pounds. They're going to recommend a tummy tuck because that's the only book that they know to read from. So you don't necessarily need a tummy tuck. If you've been told you need a tummy tuck, that is just an opinion, it's not fact. So, you know, you can see from a lot of our pictures that fold over in the front, that apron, that pannus, that does go away on the majority of our patients. We're very aggressive. We get out a lot of fat. It makes a huge dramatic change, big difference. How well the skin retracts back is going to be an individual thing. Some people have very loose skin to begin with, and other people have tighter skin. So that the people that have tighter skin, they'll respond much better. Let's see, a question here from YouTube. Can a person have multiple myeloma and get liposuction? So the short answer is yes. However, I don't treat patients with multiple myeloma, so I don't know what your specific situation is. And anytime we have any medical condition that there's a question or concern about whether you're able to have the procedure, we're going to get medical clearance. So the physician who treats you will send you back to them to get medical clearance. This is standard with any type of surgery or procedure. You get surgical clearance, in which case, if any lab values are needed, your primary care or your treating physician will get those labs and determine whether you are suitable for having the procedure. Now, with that said, you know, this is a cosmetic procedure, so if there's anything that's going to put your life in danger, for example, like if you're taking blood thinners, it is possible to stop blood thinners, and there's certain protocols that you can do. So like heart patients, for example, people that have had blood clots in the past, these people are on blood thinners. Those people can still have liposuction. There's just certain protocols and things that we need to adhere to make sure that it's safest for you. So if you have a medical condition and you're concerned, as long as things are stable, then in most cases we can go ahead and move forward. I mean, even people that have I've had patients that have HIV, patients that have cancer, you know, let's see what else we've had, hernias. People have. Let's see. I'm trying to think. See, so yeah, so you don't necessarily need. Let's see, Jessica. I guess that's Jessica. It's spelled Gesssyka. You don't need medical clearance unless there's a specific reason to get medical clearance. So for example, if you're diabetic and every time for diabetes, we need to have medical clearance because we need to make sure that it's well controlled. So we would send you for medical clearance for that standpoint. Sophia, there's no BMI required. I think maybe you were answering a question for someone else. Someone asked about consultations. So we do consultations. We actually do the consultations over the phone for most of our patients, since about 70% of our patients are flying in from out of state. We do our consultations over the phone. We make it really easy. You can just email in pictures and you'll discuss with our consultation specialist, answer any of your questions or concerns that you might have. So I'm reading questions on YouTube, and some people are writing some stuff here. Let's see. Tanya, awesome. You're coming in the 22nd for your procedure. Can't wait to meet you. Let's see, how much is it to get a spot of liposuction? Well, we charge per area, and which area you're treating is, I don't know which area you're treating, but we charge $12.99 per area. And for the specific pricing, you're going to want to go get your consultation. You can make sure you go to our website. There's actually a link there that you can click on the website, myshapelipo.com. You can click on the link and schedule your own consultation.
YouTube's asking if you have any hotel recommendations.
Hotel recommendations. You know, there's quite a few local hotels around us. I think this is the Best Western, and the Best Western is kind of nice because they actually do transportation, so they'll transport you to and from our office, and I believe that's included in their fees, which is kind of cool. There's also Green Valley Ranch, which is a casino. It's a little bit nicer, high end. I know there's some people that stay on the Strip, so any of the hotels on the Strip are about a 25-minute drive from us. But if you want to stay at a hotel casino, then that would be a good option for you. How long after lipo can you have lipo done again? So I assume that you're not talking about getting liposuction on the same area. So the liposuction on, I'm going to pin this comment on Instagram. This is our phone number for our office, so if anybody's interested in getting a consultation. So back to the question, how soon can you get liposuction again? The answer is that all I need is 1 week in between each procedure for the numbing fluids, lidocaine specifically, to get out of your system to be safe. So, and that would be treating different areas. We would not treat the same area twice within a week. That just doesn't make sense. In fact, I would never like to treat the same areas. My hope is to do the job right the first time, so you never have to get liposuction again on the same area. Okay. Let's see. You guys see any other questions?
Yeah. Do you have to have all the areas you need done all in one day?
Okay. What's up, Miss Queenificent? So the question really quick was, do you have to have all the areas treated that you want all in one day? And the answer is no. We have people, it's really, this is a preference for you. So I have my preference on what I would like to treat. So I like break things up into different quadrants of the body. So everything around the midsection, I like to treat all at the same time. Everything on the upper body, I like to treat all at the same time, and everything in the legs, I like to treat at the same time. Now, that's just a preference for me. You can break things up however you want to do it. I make my recommendations because of what works best for the patients, in my opinion, and based on my experience. We do have people that break things up into smaller procedures for cost purposes. So, for example, if you only have a certain amount of money available today, the funds available today, and you want to get a procedure, we can do a limited procedure that would cost whatever the amount of money that you have available. Then you can save up for whatever amount of time until you have enough money for the next procedure. So I definitely have people that do that. I have people that have like every 6 months they're getting another procedure. So that's definitely possible. Let's see.
Here's a classic question. What's the downtime?
What's the downtime after liposuction? So after liposuction, you're going to, the funny thing is there's some people that have no downtime at all. They go back to work immediately after the procedure, the same day. So that's possible. That's not the norm. The average person is able to get back to work within 3 days, and that's typically a sedentary type job. So if you have a job that you're lifting heavy objects or you're moving around, you're very mobile, it might take you a little bit longer. For example, I had a gentleman that was a AC repair person, and so they had to climb up in crawl spaces, and this was during the heat of the summer here in Vegas, and he's like that's going to take longer to get back to that kind of job if you have to crawl around in crawl spaces in the house and it's going to be 120 degrees outside. So that type of person, it'll take a little bit longer. But for you, everybody's a little bit different too. This is really just a tolerance thing. So it's what you can tolerate. Some people can tolerate discomfort or pain or whatever you want to call it. They can tolerate it better than other people. Those people will tend to do better and get back to doing things quicker. Let's see, April Fuentes from Facebook says, how much for the skin tightening on the thighs? So we charge per area for the Smart Lipo, for the laser skin tightening. So we kind of did this a la carte so that, you can cut costs in the sense that, you can get skin tightening specifically on the area that you want skin tightening, and you don't have to get on areas that you don't necessarily want it. So that leaves the control up to you. It allows you to control your cost and get exactly what you want instead of us just forcing things onto you. So the Smart Lipo is $650 per area, so it just depends on how many areas you want treated. Chastity, there is no pricing specific for 360 lipo. 360 lipo is basically when we treat all the way around the waistline, and so we don't price that specifically because each individual is different, and they may have larger areas that need to be treated. So if you're 150 pounds, the number of areas that you'll need treated are going to be less than the person who's 350 pounds. So get your consultation. So any of these pricing questions, I'm going to keep reverting back to. The next step is getting your free consultation. So if you guys are really serious about moving forward, our basic pricing is $12.99 per area. So it's not like I'm trying to skirt any of these questions or push you aside. But I can't, we have, a couple hundred people on the lives now. I can't give specific quotes to each individual. So send your pictures in, get your consultation. Let's see, is it true that laser lipo is the same as Smart Lipo? So laser lipo Smart Lipo is a brand of laser, just like Coca-Cola is a brand of soda. So laser lipo, there are multiple lasers on the market that do the same thing. Smart Lipo is just one of the brands of laser. They're all used primarily for skin tightening. However, there's definitely other benefits to the laser. The laser is a heat source, so it actually heats up and coagulates blood vessels, which decreases bleeding, which will then decrease bruising and um, increase the healing time. Let's see, someone asked, they're a law enforcement officer, and you'd like to have the the lipo on the apron done, and they're concerned about downtime. Okay, so law enforcement officer. So I was just discussing this about the downtime, and it's going to be dependent on the individual. So if you have a very active job, then it may take you a little bit longer to get back to your job. However, sedentary type individuals, our statistics show about 87% of people can get back to work within 3 days. And surprisingly, about 60% of people are getting back within 1 day. So a lot of this again has to do with your tolerance and your ability to do your job despite whatever discomfort. See, Brittany Burks, she's 5 weeks post-op, and she says she's in love with her shape. We do layaway plans. We do actually have a layaway plan. So the way the layaway plan works, if none of you have ever done layaway, is that we're basically like a savings plan for you. So you can make monthly payments to us prior to the procedure, and we'll essentially accumulate and hold the funds until you're paid in full. We give you 9 months to do that. So call our office. Sophia is 6-week post-op, and she's in love with her body. That's awesome. I'm so glad we get all of these previous patients on here. I think it's awesome. It gives other people that are interested the ability to communicate with you and know that this is real and that real people are getting real results. So that's a cool thing. Melissa, you're coming in next week. Cool. Communicating with Brittany, that's good. So hey, I just want also people to know, like, you're gonna see a lot of before and after photos. First of all, we present our best work. I think anybody on this planet that is doing any business, you present your best foot forward. So all the pictures that you see are going to be individuals who have individual issues. They might have loose skin, they might have thick skin, they might have tight skin, they might have lots of fat, they might, their belly might be hanging over. Everyone's different. And so because of that, the results of liposuction are different. The pictures that you'll see are showing what is possible with liposuction, but it doesn't necessarily, it's not like you can point at me like, I want that one, and then we can just boom, like create it like magic. It just doesn't work that way. So everybody has their different limitations based off of their own body structure and the way we start. So looking at other people's pictures or seeing someone else, like say if you have a friend that didn't get very good results, like it doesn't necessarily mean that you're going to get bad results. It's just some people have just different limitations that when people come to me, you got to keep in mind that I have patients that fly in from all around the world, and the first time that I see them personally is the day of their procedure. So I'm basically looking at it and I just do the best that I can. And I've gotten really good at it, and it's like I have no problem doing that. But the reality is that you just have to be realistic with what's possible for you. And despite looking at pictures, just because someone looks similar to you doesn't necessarily mean that you can get the exact same results. So this is a pretty cool picture here. This individual had just the love handles, hips, and lower back. So 3 areas of liposuction, and then the fat transfer to the butt. Was that fat transfer?
Was it Tina Gray?
Is that Tina?
Yeah.
Oh wow. So no fat transfer. Cool. Yeah. So and we treat. So you can kind of see. So with her, we treated everything around the butt. So what I like to do to create the best butt is that a lot of the problem that people have is their butt blends in with all the surrounding areas. So everything in the waistline on the side of the thighs as well. Anything that surrounds the butt is potentially going to distract away from the butt. So, and treating the waistline, the love handles, the hips, it makes a smoother waistline. It makes the waist come in as opposed to muffling out. So that's a really easy problem to fix. Fat in the lower back. Once you take the fat in the lower back, it makes your butt pop out and it creates more of an arch to your back. So taking away all the stuff that doesn't belong there is really the key to creating the best butt. Now, if you still don't have much volume in your butt, adding volume through fat transfer is a way to get and enhance and enlarge the size of the butt. Let's see, someone says on YouTube, what is the difference between lipo, smart lipo, and sculpture, or liposculpture? So smart lipo is a brand of laser. Liposuction, liposculpture, all those are different terminology for the same word. It's the removal of fat. So Smart Lipo is the brand of laser for skin tightening that we use, and all those other terms are considered liposuction or lipo, the physical removal of fat. Liposculpture was a term that was developed years ago to, I guess, when we started using smaller instrumentation, we started being able to get more details as far as the results. And so that's where I think the term sculpture came out. We're sculpting. And it's a pretty cool thing that we're able to do. I'm able to sculpt out the curves that you may have lost. So it's pretty cool. I mean, it really is sculpting. I feel like an artist. Let's see. When we do the Brazilian butt lift, what two areas do you get fat from? So this is Mariana on Facebook. So first of all, we're not limited to two areas. You can get as many areas of liposuction as you want. The two areas is the minimum that we recommend in order to get the fat for the transfer to the butt. Now, for the fat transfer to the butt, I like to personally, I think for the best results, treating at least the three areas: the love handles, hips, and the lower back. If you need those. So if you need those are going to create the best shape to the butt, create the arch to your lower back. So that's what I would recommend. I always recommend treating around the waistline if that's a problem. Otherwise, when you add volume to the butt, it just blends in with the surrounding areas, and that just doesn't look good. And you can see from this one here, we really changed the angle. So in the before picture, she was almost angling like a V, and then after it comes up from the bottom. And so you see in the after photo, it's just changing the angles, changing the shape. And the thing is that people don't realize that you don't have to be 100 pounds. It's just about being proportionate and having the right proportions, the right curves in the right place. That's all it is. And so we're creating the illusion for people to see, and that's that's really all we're doing with this. Is we're just creating the shapes that we're looking for. And so this is another one. You can see here how she kind of had that muffling of the waistline, and now we took everything around the love handles, the hips, the lower back, and you can see how I was able to shape the butt. And interestingly, when that additional weight from up above was removed, you can see that dimpling in the butt disappeared. And this is no fat transfer, is that correct?
Correct.
So no fat transfer, however, but just the removal of fat allowed for the dimpling and irregularities that she had in her butt to change. So that's a pretty cool before and after picture there. Okay, Kitsy Davis from Facebook asks, I'm thinking about getting lipo on the back of my legs. Can that be done? Yes, so liposuction can be done on any part of your body. We have the specific areas. Those are just the most common areas that we treat. But I am open to do pretty much anything. I've done, tens of thousands of liposuction procedures, so I'm pretty confident in sucking fat from pretty much anywhere in the body. The back of the thigh, typically the area that we would normally treat is up just under the butt, and we call it the banana roll. And so a lot of girls will get this like roll right underneath the butt. So we can take care of that. That's not a problem. But there's some very large individuals that I've had that, you know, they need fat taken from, you know, weird places. So I'm happy to help whatever you need. You just present the problems and I'll give you solutions. Let's see, we have another person on Instagram saying that they're loving their results. They're 2 weeks out today. In a breeze, they went shopping and sightseeing after the procedure. That's awesome. So, you know, when people, I know that there's a lot of people that think that after you get liposuction, you're going to be like down and out and you're going to be like laid up in bed. You know, some people think they're going to be like, they're out for like weeks, and that's just not the case. You know, we have people that are literally going sightseeing right after the procedure. They get up and, you know, right off the bed, and they're able to go out to lunch. So, I mean, anything is possible, but everyone's different. So you may be able to go back to doing your normal activities fairly quickly, and other people it might take a little bit longer. Sorry, I'm just plugging in here. Okay. Diana Murphy, coming to Vegas. All right. Susie Lopez, thank you for the compliment. All right, let's see if we got anything on Instagram. So you guys may know we have a contest. We have a couple contests going on right now. So we have the free lipo contest where anybody can enter, anybody's eligible, and we have a random drawing. We haven't announced the date of the next drawing. However, that's an ongoing contest. The current contest that we have going on right now is it's actually the odds are substantially better for winning this. However, it does require you taking some action. So in order to enter this contest, you actually have to place a deposit. So we're looking for people that are sitting on the sidelines. You're pretty sure you want to get liposuction. You know, you've been thinking about it for a little while. You have money. You're ready to go. So this contest is for individuals who place their deposit. And once you place your deposit, you are entered into the contest. So that means that we're going to substantially limit the pool of people that we're going to draw from for the contest. So we want to encourage those individuals that want to support us and are willing to pay for their procedure. So we're going to be announcing the contest July 1st? Is that
Yes.
the day we're saying? So July 1st, we'll be announcing the contest winner. Now, if you already get your procedure, that's not a problem. Put down your deposit, schedule your procedure, get your fat sucked out, get what you want. You want to get the fat sucked out. That's what you want. Pay for it. Okay. Now, the contest, once we announce the winner, it'll be retroactive. So if you've already gotten your procedure and you're the winner, we're just going to reimburse you back for 3 areas of liposuction, whatever the cost is. So don't worry about that. If you want to get procedure, this is meant to get you off the sidelines. Get out here and get your procedure, get what you want, get the body that you want, and be ready for summer. So summer is coming quickly. I know that a lot of individuals are going to want to get out by the pool, get into bikinis. You're going to have to get the procedure soon if you want to be prepared for the summer. It does take time to heal. So you got to give yourself some time. I would say at least 4 to 6 weeks would be a reasonable time before you get back into the pool. Kylie, she went to a plastic surgeon. She said that the plastic surgeon said that she can't get liposuction because the fat is intra-abdominal. So yeah, we call that visceral fat. But you know, keep in mind, Kylie, it's an opinion. Don't listen to everybody that tells you stuff. I mean, not even me. Go seek other opinions. This is the practice of medicine. So there's no definitive anything. So you know, just because one person tells you one thing, go to someone else, they might tell you something different. Look, what's possible in my mind is not possible in most people's minds. And that's just the way it is. So I'm flexible. I'm able to do a lot of things. Just because one doctor says it's not possible doesn't mean it's impossible. I have lots, I have lots of patients that come to me and they were told by other doctors that like chin liposuction is impossible. It can't be done. Like arm liposuction can't be done. And the only reason that they say that is because they can't do it. Doesn't mean that it's impossible. It just means that they don't do it. So, just because that individual told you something that you didn't like or you weren't happy with, just move on to the next person. I mean, you found me, so now get a consultation with us and see what we think. Let's see. Loose skin doesn't retract. That is not true. The loose skin always retracts. When we remove fat, the skin always retracts. The question is just how much, and each individual is going to be a little bit different, in different circumstances, different situation. But the skin always retracts. It's just a question of how much. And this is, again, it's just a simple physics here. So don't let these stupid plastic surgeons tell you that you have to get a tummy tuck. But it's simple physics. If my belly is full and I have 10 pounds of fat hanging out here, gravity is going to pull it down, which makes it hang. You take away the 10 pounds, it bounces right back. Your skin will retract. Your skin is think of it like a water balloon. I use this analogy all the time. Think of it like a water balloon. So when you deflate the water balloon, the skin will always retract back. The question is just how much. Some of these water balloons have been damaged, right? And so sometimes the skin was damaged. You have stretch marks, and when we deflate it, some people don't have the potential to tighten up as much as another person might have. So again, everybody's a little bit different, but I can tell you that if you look at our pictures, it's just like what is possible is amazing, and what is possible for you. You just have to be, you have to be realistic and understand that there's a whole range. I mean, look at these pictures here. This individual, her belly was hanging over quite a bit, and she's substantially smaller. And the cool thing I like about this one is I know that we cover up the breasts for censoring, but when the belly is sticking out further than the breasts, that just is not right. It doesn't look good. There's nothing right about it. So taking back the belly, losing the fat in the front of the belly so your breasts stick out further than your abdomen, that's the way it should be. That's having the curves in the right places. So when your belly sticks out further than your breasts, it distracts away from the breasts, and many women think that their breasts are tiny because of it. And again, this is the same patient with the front view. You can see how large she was and how that muffin in that waistline there is pretty much gone. I mean, she's got this. It's almost like a spare tire is what a lot of people would call this, and yeah, it's substantially smaller. View from the back. And again, you can see the angles that we created here, and it's kind of cool how she went from, a V shape to, more is coming in the waistline, and that's what we're talking about. That's where you get the curves in the right places, and it's just it's a big change. It's a big difference for this individual. Changes the shape of her butt, the way everything looks. Marie Rios, she says, any discounts when a beauty influencer has these procedures done by MyShape Lipo? We are open for people that want to help us market. So if you are a influencer and you can drive in business, we'll work with you. So we have, for anybody, for example, that is interested in getting liposuction for free, we do have a referral program. So if you can refer 3 paying individuals, you'll be eligible for the procedure or what's the word I'm looking for? A credit equal to the average of the 3 individuals that got their procedures. So if you say you send in 3 people to get their procedures and they spend $5,000 each, you'll be eligible to get $5,000 credit towards your procedure. So if you wanted to get a much bigger procedure, we'll give you $5,000 off. So the answer to that is if those influencers, if you can influence people to get procedures, you can get free procedures here at MyShape Lipo. But you got to get people to pay. You know, this is a business. We have expenses, employees, things cost. We can't just give everything away for free. Is there any reasons why a person can't do fat transfer to the breasts? Yeah, I'm sure there's reasons why. You know, cancer would be a good reason why not to do that. You know, but you know, if you have a specific issue, Brenda from Facebook, if you have a specific issue or concern, you know, schedule your consultation and let's discuss it and, you know, figure out something that we can do for you. But, you know, fat can be taken out of anywhere and fat can be put back anywhere. So it's really just a matter of if you're medically cleared or medically able to have the procedure. Is there a difference between liposuction and liposculpture? No difference. It's just a terminology. Another cool picture. I like these pictures. So you can see with this one, so, you know, she had her waistline treated and it accentuated that hourglass figure. And again, it removed that muffin top. That's a really cool outcome there. And you know, so she only had her waistline treated, but you can see how that fold at the back bra roll disappeared. And so that's a function of basically the fat underneath in the waistline. From up top, it buckles up against that. So once we removed the base, everything sags down a little bit and that fold goes away. So that's pretty cool. A lot of women think that they have to have their back bra rolls treated in order to get rid of that, and that's not necessarily the case. So I do recommend treating the waistline first, and in many cases that will substantially reduce that back bra roll. But you know, obviously there's many people that are going to need the back bra rolls treated as well. Let's see, Alexandria, you had a question here. If you do a fat transfer to the boobs, is it the same as the lipo as far as the stomach? I'm not sure what that question is, Alexandria, so please clarify. But you can take the fat from one area and then transfer to the breasts. So a lot of times, especially if you have that belly that's sticking out, and if it's sticking out further than your breast, you got to get rid of the belly. So take the fat from the belly, and it'll make your breast stick out farther than the belly. And then when we add the volume, it just accentuates that, makes it a little bit bigger. Okay. Let's see. How many areas is in the front and the back area? I would like to see if I qualify for a loan. Okay, so Danilu, this is this is a specific question that is gonna, we need to see pictures of you. So, for example, how many areas on the front of your belly? It's going to be different than, like if you're 350 pounds, it'll be different than if you're 150 pounds because, it's elongated. The belly hangs down. It's a surface area that we're covering here. So get your consultations, free consultations, and we can answer all that stuff for you. Okay. Okay, so how much of a deposit do we put down? It's the deposit says 25% of whatever your procedure costs are. So once you've had your consultation, we'll give you a quote, and then the deposit will be based off of that quote. You're awesome, Kitsy. Kitsy's like all over here making comments. The consultation is free. Let's see, the makeup junkie. Yes, your skin does retract back. Now, again, everybody's a little bit different. So if you're really concerned about looseness of the skin, you want to get the tightest possible skin after liposuction, we use a smart lipo laser. The studies show that you can get up to 57% more skin tightening when you use a laser versus liposuction alone, so that is available with us. However, every time we remove fat from an area, the skin does tighten up every time. The question is just how much. Now, if you had very, very loose skin before, then you have less of a potential, less of a possibility for your skin to tighten up. If you have very tight skin before, even if you're big, if you have very tight skin, it is going to retract back quite nicely after the procedure. May, again, I think this has to do with the skin tightening. You know, young versus old. I honestly, I don't like putting an age to the person because, you know, one person who's 40 years old might have the same skin elasticity as an 80-year-old, and vice versa. So it really depends on the individual and their own potential. So don't base just because you're a certain age that you know you have your limitations. Now, it does contribute to limitations, and it may affect things, but you know, age is just a number. That's awesome. Yeah, so we had one of our patients from today is on here making comments on Instagram. Second time coming to My Shape Lipo with Trevor. I had my upper and lower abdomen and love handles. It took less than 2 hours and it went perfectly. That's awesome. Thank you for sharing. Highly recommend. Great pricing, amazing customer service. That's awesome. Does full thighs cover the knee area? Yes. So full thighs, this is a great procedure for those individuals that are just like have obscenely large thighs. So, you know, and if, I don't mean to be rude here, but I suck fat for a living, so I can say these type of things because I can fix the problem. So if you have just very large thighs, you're going to have issues with rubbing on the inner thighs. There's these individuals that just carry all their weight on their thighs. So these individuals are great candidates for full thighs. And full thighs is considered 6 areas of liposuction for most people. We have some people that are just like very, very large, and so we have to price it a little bit differently. But the full thighs covers from the knees all the way up to the groin and takes care of the whole problem, essentially. That's what it was meant for when we called it full thighs, is to take care of the whole problem. But again, get your consultations. We can determine specifically for you. Jordan French said, Aunt Penny and Aunt Tina did it. It's my turn. You know, Tina Gray has been sending us so much business, and because of that, she's gotten free procedures. Yes, Aunt Penny was in I think it was last week or 2 weeks ago. She did awesome. 360 lipo, and she's, I want to say 60, was she 65?
No, she was, yeah.
Yeah. Yeah, she did great. She came live with us right after the procedure. 16 more days for your procedure. All right. See you soon. How long does it normally take to recover from 360 lipo? So 360 lipo, or any lipo for that matter, the healing process is the same for whatever you treat. Now, the time-wise, it takes about the same time. It's just a matter of if you treat more areas, it's going to be you know, more difficult, more challenging, because you're going to be sore, swollen, and have issues in a larger surface area as opposed to a smaller surface area. So it might take you longer to recover, just because it's just more. Our statistics show that our patients, about 87% of our patients, are getting back to a sedentary type job within 3 days. Ooh, this is an interesting question. I'm a paraplegic and have a lot of loose skin around my stomach due to significant weight loss. Am I a candidate for surgery, or would I be automatically ruled out? So no one's automatically ruled out. I have had some paraplegics over the years, not many, but I have had some. And so it is possible. And, as far as your loose skin issue, again, we just need to see pictures of you. And if you're local here to Vegas, you're welcome to come on in and we can take a look. Otherwise, if you can send us some pictures uh, so we can get an idea of what to expect, I'm sure we can make it work for you. Do you sell fajas? We don't sell fajas. I mean, fajas is a brand of compression garments, and so we have our standard compression garments that cover the areas that we treat. They're good. They're not great. There's so many compression garments on the market right now. There's some very specialized compression garments that will work well, probably better than the garments that we have. Our garments are meant to work for everyone. And because of that, they're not as specific as some of the other garments that are on the market. So a lot of times I do recommend after your procedure, when you leave here, we will give you garments to cover it. And if you want, you can stick to those. But there are other garments on the market that I'd recommend looking into that might fit you better. So let's see. Do we have to have a drain? We do not use any drains here at MyShape Lipo. Let's see. For the current contest that we're doing, you do have to place your deposit in order to be entered into the contest. The deposit is 25% of the procedure costs. This is not for everybody. So before all you people start complaining that you don't have any money or it's not free, it's free to the winner, but everybody else has to pay. So this in placing your deposit is going to significantly limit the pool of people that we'll be drawing from for the contest winner. So that means that let's just say in the next month we have 50 individuals that place their deposit. That means you have a 1 in 50 chance of winning, which is way better than a 1 in 100,000. So if you're looking to get liposuction, this is meant to get those people that are ready to get liposuction. You're willing to pay, but as an added benefit, you could get some of your money back essentially. So if you get your procedure and you end up winning the contest, we'll just retroactively reimburse you for that those 3 areas. Okay, so the typical recovery for fat transfer to the breast. So the fat transfer is a little bit different than the liposuction. When we get liposuction, we're going to put compression on the area with the compression garments. With fat transfer, we don't want to put any pressure on the area. So when you're talking about fat transfer to the butt, that means that no sitting, sleeping, any pressure on the butt, you want to avoid that as much as you can. Fat transfer to the breast, again, we don't want to put pressure on it, so that's typically, it's a little bit easier since you don't sit on the breast, but sleeping, if you sleep on your side or on your stomach, you're going to need to sleep on your back so you're not putting pressure on the breast. Also, avoid wearing tighter clothes or bras with the breast. Let's see. Yeah, and Brenda, you're talking about the you were told that 70% of the fat transferred will stay. So statistically, and what I usually tell people is I usually say about 50% of the fat will survive. But the truth is like we're just saying numbers. It's just a number. Some patients get a lot more. Some people get a lot less. Everyone's different. And the thing that you have to realize, especially when you're like reading reviews about whether the fat transfer is good or how much stays or doesn't stay, each individual is different. And the reason is that when I transfer the fat, my process is exactly the same every time. The thing that varies is what the patient does after the procedure. So for example, you're not supposed to put pressure on the area. So some individuals follow those rules, other people don't. So what I found is the people that tend to get the best results, they tell me, they were like very avid about, following the rules to a T, never putting pressure on the area. And so they tend to get a higher survival rate. Those individuals that claim that they lose all the fat, when you start questioning them, there's always something that, you know, they sat on it, or they wore a bra, or whatever it is, but they don't follow the rules. So just keep that in mind um, when you talk to people about how much fat survived. Don't it won't be determined the same as you, because everyone's a little bit different. If you want the best results, then you'll follow the rules that we give you, and you know get the best results that way. But the studies that I read and that I quote are typically 50% of the fat is expected to survive. But that's, it's an average. It's just a number. So Sheena from Memphis, we do our consultations over the phone for those coming from out of state. About 70% of our patients fly in from out of state. So we try to make it as easy as possible. So you can schedule your consultation, call our office, or you can go to, on the website, you can click on the link to schedule your consultation, and then you just email in your pictures. We can review the pictures, and we'll get you on the phone and answer any questions you might have. This is a really awesome before and after picture here. This is Candy Lover 89, or Angelica. Some of you may know her, but man, talk about curves in the right places. I mean, this was an amazing result here, and it really, you can see how it shapes the butt. And so we didn't do anything to the butt. This was all liposuction around the waistline, and so it substantially changes the overall shape. Awesome results. Nessa Gomez, we do not do lipo. We do not do drains. That's a plastic surgeon's thing. Drains are not required. What we do is we leave the holes, we call them adits, we leave those open after the procedure. So all the fluid that we put in there to get you numb, it'll drain out through those holes. And that we want the fluid to get out as much as possible. And that's the purpose of using the drains. But the drains are really not that effective. So with compression of the area, it essentially pushes the fluid out, and we use super absorbent pads to collect the fluid. Now, it may be a little bit of an inconvenience. Some people don't like it that way, but it's worked well for us. I hate drains. It's a liability, and drains are an avenue. They're essentially imagine it's like a wick for a candle where bacteria can get into you. So drains are not good for you. So we don't use any drains, so you don't have to worry about that. We're about to end in about 2 minutes on Instagram. We have a teacher saying that she's going on break next week and she wants lipo. Well, you got to get in here. You got to call us up, make sure our schedule will allow for that. Let's see. You guys see any other questions?
There's a question about the difference between general and local anesthesia.
Oh, good question. Okay, so the difference between general anesthesia and local anesthesia. So local anesthesia is what we do at MyShape Lipo. What that means is we only numb the local area, so the area that we're treating. So if we're treating the abdomen, we only numb the abdomen, so you can feel everything else. You're awake the whole time, but you're numb in the area that we're treating, so you don't feel that portion of it. So it's a lot safer. In general anesthesia, a lot of the myth here is that you just go to sleep and then you wake up and everything's great after the procedure, and that's simply not the case. Most problems with any surgeries or procedures come from general anesthesia. So if you're able to avoid general anesthesia as much as you can your entire life, I would recommend that, highly recommend that. So local anesthesia we use a fluid that goes only in the area treated, and you don't have to go to sleep. The advantage of this is you're able to get up after the procedure, you're able to walk out, go to lunch, you're able to do things later that day, and you feel good. It's the general anesthesia that causes problems. General anesthesia, people will get sick and not feel well, and that's, they'll have amnesia after the procedures. They'll have nausea and vomiting. All of this is from general anesthesia, and so we avoid all of those issues through doing local anesthesia and liposuction. These some cool pictures here. Another good picture. This is actually one of our celebrity endorsements. She's a I think she's on Channel 5. She's one of the newscasters there. So good results. Okay, let's see, Marisol. So if your stomach is not big, can you get the result of a flat stomach? So yes, but I can't guarantee anything, any of these stuff. I can't guarantee anything. I just do the best that I can do, and with what I have at hand. So Marisol, I don't know you specifically, so when you say you're not that big, I don't know exactly what that means, but anything is possible. I'm very aggressive. I'm going to give you the best chance of having a flat stomach. So if that's what you're looking for, that's what I can offer. Let's see, Sylvia, I had a tummy tuck done in November of 2019. I mean, your results are horrible. I hate the way I look. I had it done in California. The doctor did not do any liposuction, like he said. So Sylvia, unfortunately, I hear this story all the time, and I'm sorry that you had to experience this, but most plastic surgeons that are doing tummy tucks, they don't do liposuction. And if they do liposuction, it's typically they're just charging you for liposuction, and they do very little. And there's a reason for that. I'm going to explain that right now. So the reason why they don't do very much liposuction is pretty simple. Their primary goal is to get the huge wound that they, where they cut the skin away. So their primary goal is to get that to heal. And so when you do liposuction, the liposuction degrades the blood supply. So it breaks up the small blood vessels that would be supplying that wound with oxygen and nutrients to help survive. So because of that, they don't do as much liposuction because their primary goal is to get the wound to heal. And if they don't get the wound to heal, it can become a complete nightmare. So they don't want that to happen. So a lot of the plastic surgeons won't do any liposuction, or if they do any liposuction, they do very little liposuction. Now, because of that, I get a lot of patients that have had tummy tuck and now need liposuction. So because of this, my recommendations are get your liposuction first. I would say the majority of my patients that get liposuction and we're considering a tummy tuck never go on to get a tummy tuck. I would say upwards of 95 to even higher % of people don't get the tummy tuck after getting liposuction because they get good results. Their skin retracts back quite nicely. They just don't need it. So Sylvia, again, I'm really sorry that you had that experience. However, I can help. So it sucks. You're gonna have to get another procedure, but we can get the fat out of there. The whatever was left behind, I can get out, and it's very common, and the results are phenomenal. So you've had your loose skin cut away. That's great. Let's chalk it up to that's awesome. But now let's get the fat out of there and get you the curves that you need. And if you've had issues like if you've had tummy tuck and you have like dog ear deformities, liposuction can help with that as well. So some of you that don't know about tummy tucks, the dog ear deformities are when they make the cut and they pull the skin back together, sometimes it leaves pooching out on the sides here, and it kind of looks like dog ears essentially. So that's why they call it dog ear deformity. Another terrible thing about tummy tuck. Nessa Gomez, we don't offer care credit. However, we do have financing, so call our office and check that out. Maria is the front and back, 2 different prices. We charge per area, so it's not doesn't matter whether it's front or back. It's just per area. If you get liposuction, does the fat return? That's a good question. So all the studies say that fat cells don't reproduce. So the fat cells that you have, they don't, like when you gain weight, you don't get more fat cells. It's the same fat cells, they swell up. So you're not like if you eat a lot of food, it's not like you're getting more fat. You already have the fat. The fat that you have, you already have. So with liposuction, we're physically removing those fat cells, and once those fat cells are gone, they're gone forever. So now some people might say, well, but I know so and so, they got liposuction and then 2 years later they were big again. Well, the reason for that is because they still had fat left behind. And if you still have fat left behind, those fat cells can swell up just like any other fat cells. Now the key is that if you get out the majority of the fat cells, get out as many as you can, get out as much as you can, you'll be left with very little fat cells in that treated area. So even if those small number of fat cells get bigger, it won't be an appreciable difference or a substantial difference. So my goal is to always get out and do the right job the first time so that we never would have to do liposuction again, and it should never be an issue to where you feel like you're fat in that area again. Now, with that said, it's still your responsibility. You have to live a healthier lifestyle. So if the lifestyle that you're living got you into the situation that you're in now, getting the fat sucked out, it'll help. It's a it's a kickstart, but it's not going to solve all your problems. You still have to live a healthier lifestyle, and it's in your best interest if you want to live. So as many of you know, being obese causes many health problems, and nowadays I'm hearing the sedentary lifestyle is being compared to smoking cigarettes. So it's that bad. Being sedentary is going to cause all kinds of medical problems. So get up and move. Um, I can help get the fat off, but you got to start doing a better job with your life and eating better and being healthier and moving around more. Let's see. Nessa, I hope I answered your question already about the consultation. Consultations can be done over the phone. If you are flying in from out of state, my recommendations are to fly in the night before the procedure in case you have any delays in your flight, so you don't miss your procedure. And then I would have the procedure the next day. I would stay that night, and then you could potentially fly out the following day after the procedure. If you want to be a little bit more cautious, staying 2 nights would be, a third night would be reasonable. Also, traveling with somebody, so coming with somebody is advisable, particularly if you're getting a lot treated. Having someone to help is definitely beneficial. Jennifer Yang, I don't do breast lifts. However, women who have lost volume after babies, for example, we can do fat transfer. And when we do fat transfer, it's essentially like if you've lost the volume up in the upper portion of the chest here, we can transfer it to the fat up here, so it appears that the breasts are sitting up higher. So it depends on what your situation is. You may benefit more from a traditional breast lift, but if you had smaller breasts and you just want inflated and get larger and have that lifting effect of the fat transfer, that might be beneficial for you as well. Let's see, I had a question. How often have you seen blood clots occur after the procedure? That's your biggest concern. Okay, so blood clots, or it's also, if you're a medical person, it's called a DVT, or deep vein thrombosis. Anytime you have any procedures, blood clot is possible, and the reason is that when we have any procedures or do any surgeries, we're basically cutting and breaking blood vessels, and so your body's natural response is to create clotting factors. So it's going to try and clot those blood vessels, and by the increased clotting factor, it leaves you at a higher risk for getting blood clots. So anytime you have any procedure, you're at a higher risk. People that have had blood clots in the past, you're at an even higher risk for getting a blood clot a second time. Women who are on birth control, you're at higher risk as well. So how often have I seen it in liposuction? I think over the, it's been 12, 13 years now, I've probably seen one confirmed, and there was I think a few people that were concerned about it, but it turned out not to be a blood clot. The one person that was confirmed a blood clot, she was a high risk. She was 64 years old, and she drove down from somewhere far. It was like 8 hours away. So when she drove home, I think it was either the same day or the next day after the procedure. She was trying to save money, and she never stopped. She drove straight through, so she never got up, and that's going to put you at a higher risk. So you're going to get blood clots when you're in a sedentary type position. So typically blood clots are when patients are sitting in the hospital beds. But after liposuction, the good thing is you're up walking around, and so that's the advantage. So, but those individuals that are like driving immediately after, and you're sedentary for extended periods of time, that's going to put you at a higher risk for blood clots. So just make sure that you get up and walk around regularly, and that'll decrease the chance for getting blood clots. Like 1 in 15,000 patients got a blood clot. So I think that's pretty good odds here. So SB, I wouldn't be too worried about it. If you're worried about it, if you're concerned about it, you just got to do the things that are necessary so that you don't get a blood clot. Let's see. Okay, so someone was asking if I get transferred to the butt, how will I travel? So fat transfer to the butt, first of all, it's not easy. So you're not supposed to put pressure on the butt afterwards. So sitting, sleeping, all these become challenges. So those individuals that are choosing to get fat transfer to the butt, mentally you have to be with it. You have to be able to comply with the rules. So traveling is obviously a challenge. So Kristen asked, how can I travel when I get fat transfer to the butt? So it's possible. It's not easy. We give you a pillow that you can sit on, and essentially what you're doing is the pillow is putting the pressure on your thighs and allowing your butt to kind of hang off the back. Driving, that's an issue, but you still have to get to work, right? So these are issues that you need to deal with this is your life, your results, your body. You want the best results, and you have to do the things that are necessary to get those kind of results. But it is possible, Christian, and we have many, many patients that do it. So it's definitely possible. The people are still getting good results. I highly recommend, just getting up and walking around on the flight. And we have lots of the flight attendants that come here for procedures, so they're up to date on this. They know what so just let them know what you're doing. Also, we have so many patients that fly out of here. I'm sure they've dealt with some of our patients. So just let them know that you've had the procedure and see if there's any way that they can accommodate you. Okay. Yep. All right. I'm getting tired. Okay, so you guys see any other questions I haven't answered?
Just a bunch of kudos.
Okay. Well, I appreciate kudos.
Looking forward to seeing you. They've followed you for years, watching YouTube. Your work looks amazing.
Well, I appreciate each and every individual that got on here to watch this. and I hope I answered all your questions. I'm on here usually every week. But if you have any other questions, you know, the next step, if you're ready to get started, is to get your free consultation. So, you know, call our office, schedule your consultation, go to our website, myshapelipo.com, get your consultation. Those of you from out of state, you can do this over the phone, so we make it really easy. If you're local here, come on into the office. But that's the next step, and from there we'll get you a quote and specifically the cost. So it's free. There's no, you know, you don't have to put any money down. The cost for the consultation is free. So just, you know, get your consultation, find out how much it costs, figure out how to make it happen. That's the way it works. So thank you guys for watching, and hope you have a great day.